Hello everyone, my name is DonHee. I'm from South Korea. I'm very happy to present my published paper. The paper published on technological forecasting and social change in this year. So please refer to the published paper to have more insight. Thank you. The presentation is divided into four sessions. First, introduction. The background and purpose of this study will be briefly introduced. In literature review, the development stage of continuous service in healthcare industry will be reviewed, and in third part, the opportunities and challenges of the healthcare industry will be introduced. And then the conclusion will briefly present with these research limitations. Now, introduction. The global outbreak of coronavirus pandemics has provoked the shift to remote work in many industries to prevent the spread of infectious disease. As direct person-to-person contact is being circumvented, consumers' purchasing behaviors have rapidly transitioned to online media. So organizations have developed the cloud-based information technology infrastructure to pursue new opportunities in offering continuous or contact-free service through mobile software, video conferencing, expanding telemedicine, e-education, telecommunicating, and mobile transactions. As infectious COVID-19 persists, continuous service using advanced technologies are likely to infiltrate people's daily lives. The pandemic has brought new opportunities for the service industry as the digitalization of operational processes is being expected. Specifically, the online retail industry is experiencing an unexpected renaissance owing to rapid spread of contact-free consumption patterns. In the pandemic crisis, many businesses began to focus on building a less risky, if less efficient supply chains. For example, many companies have started moving their core supply chains to their home countries through reshoring strategies that are licensed by their government. Digitalization will be most significant aspect of the global value chain strategy in the post-COVID-19 era, suggesting the need for automated operational systems that leverage big data, Internet of Things, blockchain, robots, drone, and 3D printings. Currently, COVID-19 is spreading across the globe, and it is not certain exactly when it will be end. The healthcare industry is no exception. In this age, many hospitals and care providers have actively pursued innovations for continuous service and operational process for improved productivity and organizational agility. Through applications of advanced information and communication technologies such as artificial intelligence, Internet of Things, big data, 3D printing, virtual and augmented reality, smart sensors and robots, drones, etc. Various content services has been implemented. Telemedicine, which have been widely predicted since 1990, while before the COVID-19 pandemic period is one of course part of continuous healthcare service. However, continuous healthcare service in this age encompasses far beyond the traditional scope of telemedicine. So, in this study, we examine telemedicine service that have become prevalent in the healthcare industry during the pandemic and propose strategy for effective operations for telemedicine even in the post-COVID era. We reviewed literature on type of continuous service and categorized their delivery in the pre, during, and post COVID-19 period. Now I'm briefly introduce literature review part. First, digital transformation and continuous service. With the pandemic, challenge or aspect of people's daily lives. There is a belief that the pre-COVID-19 normal would never return because many governments and organizations have implemented various IT-based countermeasures. Is very sad, right? Continuous service have gained a renewed significance as a preferred service type by an increasing number of customers during the pandemic. Continuous service refers to a method of service delivering that involves indirect interaction between peoples instead of the traditional method that involves direct person-to-person interactions. Although digital transformation in organization has accelerated to prevent a spread of COVID-19, some of the contained services have existed either prior to pandemics or were developed during the pandemics. It may see some major changes in the post-COVID-19 era. We reviewed the literature of the type of continuous service and categorized as in pre, during, and post-COVID-19 period. First, continuous healthcare service in the pre-COVID-19 era. In the first industrial revolution era, the healthcare industry has implemented various innovations that have overcome the limitation with space and time in providing healthcare service. Advanced in AI and ICBM have enabled a widespread use of wearable devices in various forms for health monitoring and disease prevention. In the pre-COVID period, in addition to telemedicine, there were a number of continuous healthcare systems in use already, right? At the dawn of the first industrial revolution, smart healthcare emerged through the convergence of advanced IT such as AI and ICBM. Second, continuous service during COVID-19 era. The COVID-19 pandemic has demonstrated the importance of public health care and the need for innovative approaches to combat global pandemics. During the COVID-19 pandemics, many patients preferred continuous online treatment rather than face-to-face treatment. The patient don't want to visit our healthcare office or hospitals. According to telemedicine service, which naturally continuous and widely predicted in the pre-COVID-19 period, have expanded rapidly because they do not request direct interaction between the patient and medical staff. Third, continuous service in the post-COVID-19 era. Telemedicine services have emerged as an effective healthcare delivery method during the pandemic, and this trend is expected to accelerate in the future. Thus, now in the time to explore the direction and the expansion of telemedicine service in post-COVID-19 era. I think so. Now I will suggest opportunities and challenges of continuous healthcare service. Continuous service emerged as an innovation for creating competitive advantages in the first industrial revolution age. The rapid spread of virus has forced government and organizations to disclose face-to-face service in all areas, including personal lifestyles, education, work, and manner of engagement in community activities. We have lots of experience in this situation. Previous studies suggest that organizations can remain competitive if they can decipher how various technology-based services, which were introduced with agility during the pandemics, would need to transform the post-pandemic period. Therefore, for individuals, corporations, and government to search for new opportunities, of creating value and social capital while responding stiffly to new normal in the post-COVID-19 period. The healthcare industry is expected to encounter new opportunities and challenges in post-period COVID period. Thus, we suggest the four aspects of opportunities and challenges for healthcare industries. First, building on innovative healthcare delivery system. Second, distribution of healthcare resource during on offline service. Table 1 shows the trend of major healthcare indices of OECD and four member countries as USA, UK, Japan, and Korea during about 10 years period. Based on the tables, we understand why we need to develop continuous service in healthcare industry. As shown last columns, life expenditures is in 28 to 2017. Their value will be increased, so we need lots of resources in healthcare industry. Third, expand the applications of continuous healthcare service. And lastly, psychological stability. Table 2 summarizes the opportunities and challenges the pandemic has bring to the healthcare industry. As you see the table, we suggest several opportunities and challenges. Please review and understand what I suggest opportunities and challenges in our healthcare industry. Now, I shall discuss about our papers. Today, online and offline service coexist. Thus, there is a need for effective systems of connectivity between these two subtypes, not only in the healthcare industry but also in other industries as well. This study first examined the types and the background of various continuous services by dividing them into three distinct periods, as I mentioned: pre, during, and post COVID-19, in order to analyze the opportunities and challenges they bring the healthcare industry in the post COVID-19 era. Then we examine some representative case of continuous healthcare service in various OECD countries to identify a trend of change in treatment method during the pandemic. The pre-COVID-19 period was categorized by the beginning stage of expansion of various continuous service and exploring applications of digital device owing to digital transformation. Current our situation, we are still in middle of pandemics, so overall the continuous healthcare service have explored to migrate the pandemic by leverage advanced ICT technologies. This study has some limitations. First, we categorize the time period around the COVID-19 pandemics into pre, during, and post. Our categorization of the COVID-19 pandemic period may seem premature as the world is still battling with the virus, even experiencing such approaches. We use such categorization to create a framework for the future development of operational strategies to cope with post-COVID-19 challenges based on current situation. So we hope this study on continuous healthcare service such as this one will stimulate future research for developing smart healthcare organization for treating, predicting, and preventing various types of disease, including infection ones. If you have any questions, please contact me through this email. Thank you very much.